We've talked a lot about the issue of chronic pain and the people who suffer and struggle with chronic pain. You've heard the people who are struggling. You've heard their family members. You've heard some very disturbing stories. And there's over 1 million people, as I understand it, in this country who are dealing with chronic pain. Many of them are dealing with absolutely abhorrent realities, and they're being cut off from their prescription medications, opioid medications, in many cases, arbitrarily cut off. And we've heard patients say that their doctors told them, I'm cutting you off this, or I'm weaning you off it, or I'm arbitrarily cutting back on you on your medications because I don't want to lose my license. Now, when you talk to colleges of physicians and surgeons, they say that's not going to happen. But I talk to patients who tell me that repeatedly, that this is exactly what happened to them and continues to happen to them. The College of Physicians and Surgeons of Ontario sent out a notice to doctors in the province instructing them to not arbitrarily, dramatically cut the opioid medications for the chronic pain patients. And yet it's going on. And what is the college doing about it? I'd like to ask them, but even though they initially agreed to come on this program, have their president appear on this program or their registrar. I can't remember whether it was the president or the registrar, one of them. I'm happy to have them both on the show together anytime. They then rescinded, turned away and said no, they weren't going to do it. Maybe my questions are a little too direct. I don't know. But people are suffering. People are struggling. Barry Ulmer is the executive director of the Chronic Pain Association of Canada. And the CPAC did a survey of the agony inflicted on pain patients across this country not long ago. And the Chronic Pain Association of Canada insists the Canadian Pain Task Force, which was put together by the government, is failing chronic pain patients dramatically. By the way, you may remember Dr. Alex, I think it was Crabtree was on this show from UBC. I apologize if I mispronounced her first name. But she was on this program a couple of months ago, and UBC and Dr. Crabtree had conducted a study which showed that of deaths related to drug involvement, only just over 2% involved solely prescription opioids. The rest were combinations of street drugs and other illicit drugs. So it's only just over 2%. And Dr. Crabtree told us on the air that it's time for a new methodology to be employed in Canada as far as prescribing or refusing to prescribe prescription opioids is concerned for pain patients. So Barry Ulmer is with us, Executive Director of the Chronic Pain Association of Canada. And we also have Maggie with us. She is an Ontario resident. I'm not going to tell you where she lives, not important. But what is happening to her is important. Maggie, how are you?
I'm okay, thank you.
You're not okay?
No, I'm in a lot of pain.
How often is the pain part of your life?
24/7, actually.
And on a scale of 1 to 10, where would it be?
Most days it's at about an 8, but it does get worse as the day goes by and becomes closer to 10.
And it severely limits everything you can do in your day, correct?
Definitely.
Simple things that we all take for granted, like personal hygiene, like cooking for yourself, that sort of thing.
Exactly. I haven't been able to take a shower in over a year.
How long have you had this pain?
It's been about 25 years, but it's gotten progressively worse over the last 15.
And what shocked me, I'm sure is going to shock many people listening to this program right now, is what happened to you. Now, you were, you found with the, I don't want to put words in your mouth, so correct me if I say anything that's incorrect here. With the, working cooperatively with your doctor, you found a dosage of opioid prescription medication, perfectly legal. It's available to be prescribed. You found a dosage that restored some quality of life for you,
Yeah.
right?
Yes, that's correct.
So if I were to say to you today, Maggie, can you go out this afternoon? Could you go do some Christmas shopping? Could you go for a walk? Can you get in a car with a family member, somebody in your household, and go somewhere? What's the answer to those questions?
Definitely not. I'm unable to move off this couch or the bed for more than about a minute at a time.
A minute at a time.
Yeah.
So how long has this, I want to get to the point where your medications were cut. How long has this current situation been going on?
Almost 5 years.
Now here's what's going to surprise people. How much medication were you on?
2.5 mils of injectable hydromorphone.
A day. Is that correct? Per day?
Yep,
2.5 milligrams.
that's correct.
What happened when you were told that this 2.5 milligrams, which is a tiny dosage, this 2.5 milligrams was going to be stopped? How were you told?
Doctor said that he was being shadowed by another doctor because he thought he was overprescribing, and that struck me as hilarious because this doctor is a pain specialist and that's what he does. And so he said he wanted to wean me off the opioids and try me on some other medications. I tried about 3 or 4 different ones. One helped for about 3 months and then stopped. And I've been without any pain help since then.
So you did what your doctors asked you to do, to try.
I tried everything he asked me to try, yes.
This became so bad for you that you applied for MAID.
Oh, twice, yes.
And what did they tell you?
Well, after going through the process, filling out all the reams of documentation and getting all the signatures and everything, the doctor came to my home and did an evaluation and then told me that because pain wasn't going to kill me, that I wasn't to be considered for MAID.
Cody sends email to roy@roygreenshow.com. Chronic pain patients in Canada and the U.S. are victims of politicians acting like they care about drug addicts and people who overdose. It's lazy policy that does nothing for addicts and harms people like Maggie. It's sickening, writes Cody. Maggie, hold on. I'm going to talk to you again in a minute. Just catch your breath. Barry Ulmer is the executive director of the Chronic Pain Association of Canada. Barry, how unusual is Maggie's story?
Oh, it's not unusual at all, Roy, and it's just simply getting worse with the COVID thing as well. It just grows and grows and grows.
When you say it's getting worse, what's happening?
Well, more and more people are losing their doctors. They're not able to get out and see doctors because of the restrictions, and other doctors are simply dropping out of the field because they're still being, I guess, persecuted by the colleges, even though the colleges indicate that they're not doing that. The fact is they are.
So the Chronic Pain Association, your association, did a study, a survey of pain patients in this country. What did you come away with?
Well, just told us how really dreadful the problem was, and people are out there suffering needlessly, and things have to change.
So when you know about the Canadian Pain Task Force, which was, if I understand this correctly, put together by the government, What are they doing that's useful, and how often do they actually, confer with you, with the Chronic Pain Association of Canada? How useful is their work, would you say, and how often do they communicate with you?
Well, actually, they've never communicated with us. In fact, we've sent out information, so on and so forth, and we've made a point to them that when it was chosen, it seemed to have been pre-filtered or handpicked, so they would get people on it who would represent views of other than what we had basically, and which continues on. In fact, the co-chair of that committee has blocked us from sending her information. So they have.
Oh, that's helpful.
To us,
That's helpful, isn't it?
Oh, absolutely.
How many chronic pain patients are there in Canada?
Well, the numbers vary, but we would estimate around a total of 8 million, and out of that there would be around 2 million who suffer from severe pain, who are much like Maggie and have trouble getting any type of care because it's just not there.
So would it be fair to say that a significant number, a significant minority, a slight majority, or a large majority of the 2 million or so chronic pain patients who find themselves in a situation similar to Maggie, would it be fair to say that they are worried and with cause?
Oh, without a doubt. Terribly worried.
So what happens to them?
I guess they end up like Maggie, suffering, and we're getting more calls about the MAID program as well, which of course we're not involved in, but I understand the reasons for it, and more and more like that, and of course there's been suicides, which we'll never know the real numbers because they don't track it.
Yeah, I remember speaking with an anesthetist who was very active in the pain field. Used to come on this program, doesn't any longer. And she said that I think there were 4 stages. One was pain, the second was social isolation, the third was depression, the fourth was suicide. You heard that too, huh?
Yep.
Those numbers in that order.
Yep.
Maggie, I don't want to ask you this question, but I know why you're doing this. I know why you're talking to us today. You're not doing it just for you because you want your story told. You want people to understand what pain patients like you are enduring. When did you decide, God, I hate asking this question. When did you decide that dying was preferable to the agony that you're enduring?
It was shortly after I was taken off my meds, and I had been to local hospitals a couple of times and been treated like an addict who is looking for a high, and they just made me wait for hours upon hours on end, and then finally would reluctantly give me an injection and send me home. And then I'd go to bed that night and I'd pray that I wouldn't wake up next morning. And unfortunately I do. And it just starts all over again.
Has anybody suggested to you different options, different choices of treatment other than medications? Somebody directed you to different options and opportunities?
Yes, actually. There's a program run by the Ottawa General Hospital, which I did attend. And it consisted of several different disciplines: occupational therapy, psychology. They had a GP, a couple other ones that I can't recall.
Yeah.
And I attended it. It was about several months long. And after seeing the GP twice, the second time she told me that there was nothing more they could do for me.
what you need is that 2.5 milligrams
Yeah.
of injectable prescription medication.
And that was flatly
distributed tonight.
refused.
That's all you
Flatly
need.
refused.
That provides you with some quality of life and will allow you to get on with your life, at least
Yeah,
somewhat.
I could actually do some of the things.
Yeah. Maggie, I'm going to stay in touch with you as I do with other pain patients.
Mm-hmm.
Thank you for joining us. Thanks for talking to us today. And I'll stay in touch with you and see if we can find some way to help you. Maybe somebody in the medical profession who's listening in the Ottawa area has a heart.
Yeah.
Barry, what's the contact information for the Chronic Pain Association?
It's email is cpac@chronicpaincanada.com.
Okay.
You know, right?
CPAC
Just
at
like
Chronic
to say
Pain.
that, you know, I doubt that even with this task force, we'll ever have a pain strategy. At least coming from these type
Yeah.
of full consultations, they're smoke and mirrors, and it continues on.
Okay.
And it's under the auspices of course, the Canadian Center on Substance.
Barry, sorry, I have to stop you, but we will do this again.
Okay.
And the website is, real quick?
www.chronicpaincanada.com.